Well, joining me now to give us some perspective on these weight loss drugs is Dr. Alicia Shelly. She's an obesity medicine specialist in Georgia. Thank you so much for joining us. Dr. Alicia, we heard just yesterday that the UK watchdog actually rejected Eli Lilly as a weight loss drug, saying they needed more evidence before they could roll this out to the NHS. As an obesity medicine physician, what is your view on whether this medication and others like it are safe and effective when it comes to losing weight?
Well, it's understandable that the watchdog wants to get more information. This is a new medication, first in its class. And so when it's the first medication, you want to get as much information as you need. And so I am excited about these medications. I feel that as time goes along and they realize the efficacy of it, the safety of it, and then also the cost effectiveness of the medication, I think eventually will be approved and will be available for people to take.
So you're excited about this. You say the safety aspects are there or they're coming along, but we know that these drugs do come with side effects, which can be quite crippling in some ways. Can you talk us through those?
Yes. So with this particular class of medications, the way they work is they work at the level of the stomach. And they slow down the gut motility. So a lot of the side effects kind of stem from that. So some of the patients do complain of having nausea, vomiting, sometimes stomach upset. How we try to reduce those side effects is by tapering up on the medication slowly. But for some people, they may not be able to take it because those side effects are too great.
So the way it works is that it sort of reduces your appetite, essentially, right? By restricting food from moving through the body at a sort of metabolic rate. Do these drugs need to be accompanied by diet and exercise? I mean, how likely is it that if a patient stops using these drugs, they will just put the weight straight back on?
So definitely this needs to be done between exercise and lifestyle changes and diet, because unfortunately obesity is a chronic disease. So a lot of times when people are just taking medication and not having the lifestyle changes, what will happen is once they stop the medication, the weight will come back. So it's important that as people are losing weight with the medications and diet and exercise, taking these habits and making them part of their lifestyles, part of who they are, so that they're able to, once they get off the medication, be able to maintain their weight.
As you say, we are in an obesity crisis. We were just saying there that by 2035, over half the world could be obese, which is kind of staggering, actually. Some may view these drugs as being a shortcut to losing weight, but in your view, I mean, are these type of drugs the answer to the crisis that we're in? Are they necessary?
They're definitely necessary. So when we look at other chronic diseases like high blood pressure or diabetes, we don't bat an eye when we add a medication to help treat those conditions. It's the same with obesity medicine. It is a chronic disease. There are multiple reasons why people gain weight. It's not just because of the fact that they're eating too much or not exercising enough. Sometimes it's because it's genetic, it's in their genes or hereditary. Sometimes it's due to conditions that people have, like PCOS or thyroid disease. And sometimes it can be medications that are causing us to gain weight. And so we need to look at these anti-obesity medications as a way for us to be able to help people who are struggling with obesity to be able to lose the weight and live a healthier life.
That may be so, but I want to talk to you about body positivity, because it does feel over the past decade that we have kind of reached a point where people are more accepting of different shapes and sizes. There has been to a degree a celebration of different types of bodies. Could these drugs be damaging, really, in the progress that we've made in that degree?
No, I disagree with that because I think we should love our bodies regardless of where we are, whether we have extra weight or we don't have extra weight. I think that should still be the same. These medications allow us not only to lose weight, but to be healthier. If you think about it, for every pound that we have, it's like 4 pounds on our knees. So if somebody loses 10 pounds, it's like you're losing 40 pounds on your knees. And a lot of times, especially with my patients, they complain of knee pain, they complain of back pain. So if we can allow people to lose even just a small amount of weight, 5 to 10% of their body weight, it can reduce that pain and allow them to be more mobile and allow them to be able to, go and play with their kids, their grandkids, and have a healthier life that with less pain. And then that's the same. So I think it is important to have body positivity regardless of wherever you are in your weight spectrum. But these medications can help with you being able to achieve a more healthier life.
I I hear what you're saying. I say the only counter to that is, as long as the right people are taking these drugs for the right reasons, because obviously
Definitely.
you have to be clinically obese. Dr. Alicia
Yes,
Shelly, I
that's
really
correct.
appreciate your
Yeah.
thoughts on this. Thank you very much.
Thank you very much.
All right, finally this hour, Barbie.